Hello and welcome to the latest episode of the Men's Manual podcast. Today we're talking to Dr. Raja, who's the lead hair transplant surgeon at Manual. Hopefully we're going to be covering some of the main causes of hair loss, a lot of the things to consider before you get a hair transplant, and also bust some myths around hair transplants. So first off, what are the main kind of types of hair loss that you see?
So the vast majority of cases that I treat are male pattern hair loss or androgenetic alopecia, which is very common. About 95% of my caseload. There are other causes that we see like female pattern loss, also traction alopecia, which can be caused by pulling on the hair over a long period of time. It's treated in a similar way, but there's other considerations there, and also other types of alopecias, and we have some overlap with dermatologists for medical treatment as well.
So before men go down the kind of route of a hair transplant, what are the kind of things that they can look at doing, and how effective are they?
I think the most important thing for them to consider is where they are in the hair loss process. So depending on how old they are and how early they're starting treatment, that might change considerably. I would normally recommend to patients to look at medical therapy in the first instance. And the focus should be on slowing down and stabilizing the loss that they're experiencing. So with male pattern hair loss, we know that in simple terms, that's a genetic sensitivity to DHT or dihydrotestosterone. And that can be countered with medication successfully. And if we're able to do that, we can stabilize the hair loss going forward. That gives them much higher chances of success with a transplant and means that we can get them better long-term options as a result.
So you said there that it's kind of about finding a treatment that stabilizes hair loss.
Yeah.
If you've lost some hair already, like I have, is there what's the probability of you getting it back from using some of those treatments?
In my experience, normally when we see a recession at the hairline, the chances of restoring that recession are very limited, if any. So you would see some improvement in the density, perhaps, just on the periphery of where you're having the loss. But where you've already lost the hair, it's not actually going to come back. So once those follicles have miniaturized and actually fallen out, they don't grow back. And that's why we would look at a hair transplant surgery as an option. So crown loss tends to be concentric in nature. So you tend to find that hairs in between are thinning. And at that point, I would look to start a patient on medical therapy to counter that process. And actually you tend to find with those crown loss patients, it tends to improve dramatically in a lot of cases. So you tend to see a dramatic transformation, and oftentimes patients who present to me with that loss and thinning in the crown, I will send them on medication for 6 months and then bring them back for a review. And they might not even need a transplant at that point.
Interesting. And what about other kind of treatments? So obviously there's the medical kind of side of things. What about things like, well, I guess PRP is kind of a medical one, but then there's also things like red light therapy and microneedling, all that kind of stuff. What are your thoughts on those?
Absolutely. I think there's definitely a role for all of these. I tend to assess on a case-by-case basis. You might have somebody who's tried medication and they've hit a wall when it comes to improving in terms of the density, or they find that they want to take it to the next level. Medication tends to plateau at a certain point. And then we tend to find other non-surgical treatment options like injections or microneedling, and perhaps low light therapy might be beneficial. In my experience with laser particularly, tend not to see a massive improvement. There is a subtle improvement there, and there's some evidence there to suggest that it is effective, but I wouldn't consider it as a primary treatment option. A lot of my patients, they've had an experience of that, where they're wearing a cap or going to a clinic and having the light therapy, and it's very mixed. Some people see a difference, others say they haven't really seen any improvement. Whereas non-surgical treatment options like injectables, and there are a variety out there now, systems that we use, there is good evidence now to suggest they are effective. And some of the papers I've read suggest that they can slow down or even reverse to some degree the hair loss process in men.
Oh, right. Is that like PRP injections? Is that what you mean by injections?
Yeah. So, I've read studies with platelet-rich plasma injections and microneedling combined, which suggests good stability in patients that are having regular PRP treatment. And to some degree, it can possibly reverse the hair loss process in the similar way medication might do. So that's also a good option to look at if patients are not responding well to medication, if they're having side effects to it, or if they just don't want to take the medication in the first place.
Who are the kind of best candidates for having a hair transplant?
Again, this is very individual because everybody's at a different stage. So, I would say that the most important consideration is if it's affecting your confidence and self-esteem, I would definitely consider having it done, because a lot of the time we're actually treating the psychological impact that hair loss is having on men or people in general. So that's the first thing I would suggest. Secondly, if you treat it early, usually it's much better outcome. Now, that doesn't apply to everybody, because there's a certain age where, let's say if you're 18 or 19 years old and you're looking at a hair transplant, that could be detrimental, because at this early stage, hair loss can be more aggressive. So if we do a hair transplant very early on, then you might be in a situation where you're left with just the implants and you lose a lot more hair aggressively.
Right, so almost you start losing it behind the hair transplant almost.
That's right, yeah. So you're left with the implants, let's say at the hairline, and then behind that you have a large gap which can look unsightly. So a lot of patients I've seen over the years have come in with this problem because they've gone to clinics where, they said, yep, we're going to do a hair transplant for you. They didn't really counsel the patients on long-term prospects. And then they've gone ahead, and in the short term, first couple of years, they've had a good result, and then they've aggressively lost the rest of the hair. Because they haven't considered other options like medication for stability, it then turns out they've lost a lot more hair and ended up needing more and more work, and leaves them in a really bad situation.
So I guess this is part of the reason why it's so important to choose a surgeon that knows what they're doing, but also cares about your results and is going to be honest with you.
Absolutely, yeah.
What do you think about the kind of clinics in, Turkey is the classic one. Everyone says, "Oh, go to Turkey and get a hair transplant done."
Yeah, so in terms of Turkey, I think there's a tendency for a lot of British clinics to, bash the Turkish market. And I'm really conscious not to do that, because I know a lot of Turkish surgeons. I've been to Turkey, and I think, they do get a lot of bad press, but it is for a reason as well, because we see, sometimes horrendous cases coming from there. By and large, the problem with the cases that we see coming from Turkey, they all follow the similar pattern. And that pattern is often it's over harvesting. So they take a huge amount of follicles from the back of the head, which we would consider to be unsafe. And then very low, pluggy sort of hairlines, which are very straight. And the common theme is I found this is from my experience, they give the patients what they want, which is not necessarily a good thing, right?
Right. So is it like over-promising? So you kind of go, well, I've lost quite a lot of hair and I want it all the way down here. And you would probably say, well, that's going to look unnatural and we can't take as many from the back of your head as that.
Yeah.
And they'll just some of them will just do it.
Yeah. That's the problem you have, you see. So, patients will say, right, I've seen so-and-so picture online and I want my hairline to look like this. And if it's not possible, or if it's not going to get you a natural looking result, I would always say no. But a lot of these clinics will just take it on and do it, right? And that has its own load of problems that come with it. It tends to be over harvesting, poorly placed grafts, which can be very difficult to correct as well. So that's, by and large, that's what we see from the Turkish clinics producing those type of results. But the worst results I've seen in my career have been local. They've not been from abroad. Yeah. So there tend to be clinics in the UK that are lower cost. And you wouldn't imagine that, but the Turkish clinics have refined their work to a certain standard because they're producing these results day in, day out, and they're doing huge volumes. Clinics in the UK that pop up and close down regularly at lower cost, they tend to produce poor results a lot of the time. You
mentioned that some of these hair transplants look pluggy. What does that mean?
Yeah, I mean, that term stems from what we used to call plugs, right, which were the original sort of hair transplant. The older fashioned way of doing a hair transplant, we would take chunks of skin out. Now, I mean, we take follicular units individually now, but they used to be called plugs, and they would sort of place them in the hairline, for example, but it looked very much like doll's hair. So it's almost like a doll's hair type appearance.
I know exactly what you mean by that, and I think I've seen that before, where you can kind of see almost like the lines and
And the hairs placed at the front are classically very thick hairs. And briefly going into the reason why that happens, I mean, when we do a transplant, we're careful to place single haired follicles right at the very front of the hairline to replicate a natural hairline, because there's always a softness to the hairline and it gradually transitions into thicker hair. Whereas with these cases, you tend to find that they don't separate the singles from the multiple haired grafts because it's more time consuming. And then that ends up causing, the plugginess that we referred to.
And you also mentioned that it was kind of unsafe to take too many follicular units, is that right? Or I guess the older grafts from the back of the head. Why is that?
So it's important to know that every time you take a graft out, it leaves a little dot scar, right? And that hair's never going to grow back. So we can only take a certain amount of grafts before those scars start to join up and start to become visible with the hair at a certain length. Now, I tend not to do more than 2,000 to 2,500 grafts per session in the average person. That is, I would consider that to be a safe volume of grafts to take. And you tend to find, I've done cases where I've even pushed that a bit more if they've got a generous donor area, and patients have come back to see me in a year's time with a skin fade and you can barely see the scars. But then there's other patients where you do 1,900 grafts, 1,800 grafts, and you can just about start to see the scarring. So important to know, everybody scars differently. If you take more than that, in my opinion, there's a risk of that scarring being a lot more visible. And my patients usually, a lot of the time, are very conscious about visibility. They don't want people generally to know that they've had a hair transplant, or they don't want it to be detectable. So I'm very careful to try and maintain that discreet nature to the procedure. And that's why we try and limit the graft volumes.
So what are the main techniques that are used for hair transplants? What are the big differences? Like, which is best, which is not best, or does it depend on the patient?
Yeah, I mean, there's a lot to cover in that, in the answer to that question. But to put it simply for you, there's two main types of surgery that we do nowadays for hair transplant. The FUE, or follicular unit excision, that's the most common option. And that's where we take the individual follicles from the back and sides of the head usually, and then they're implanted into areas of loss. The FUT, or follicular unit transplant, is where classically we take a strip of skin from the back of the head. That's then closed over with stitches. And then we break that strip of skin down into individual grafts and they're implanted back in. So they each have their own merits. The problem nowadays with the FUT surgery, for a lot of my patients, they're very particular about scarring visibility, as I mentioned. So, FUT does produce a line scar. It would be more appropriate for patients who have longer hair because it would conceal the scar better. So we tend to look at that option if we've got a female patient, for example, because they're much less likely to shave the hair down. But nowadays, because people tend to keep shorter back and sides hairstyles, they're very conscious about scarring. So by default, FUE is a more popular option. But largely they're the two main options that we offer.
So in terms of the actual results, on the front of the hairline, they have similar results then, because it's just different ways of harvesting the different follicles. Is that right?
That's right. I mean, if you're looking at volumes, FUT or strip surgery might be a better option to consider if you've got a really extensive loss, because it means that if you have an FUT procedure, you can then have further FUE procedures as well. Whereas if you start with an FUE procedure, the more FUE you do, the more scars you're going to have around those previous scars. So, there's some considerations there. If you've got really extensive loss, you might consider FUT as an option. In my opinion, when we're doing an FUE procedure, it gives us a bit more flexibility in terms of, being able to select the right grafts that we need, because we can pick them individually. So we tend to go for the ones that have more hairs per graft, because that will by default give you a better density in a lot of cases. So, there are merits to each method.
Okay, so there's quite a lot to consider as well, by the sounds of it. That's probably why you need to talk to someone before you choose, right?
Absolutely, yeah.
So now what we're going to do is we're going to look at a few examples of some hair transplants gone wrong. And Dr. Raja is going to explain why this has happened and hopefully how to avoid it.
So these examples are taken from the ISHRS, part of the Fight the Fight campaign, for which I've been an ambassador in the past as well. which is, trying to counter botched surgeries that are happening around the world. So these are good case studies, courtesy of ISHRS. Looking at the first one, we can see that what we talked about earlier, having a hair transplant too early, that can lead to a situation where you have the implants in at the front, but then you lose the rest of the hair further back. And that's an example of poor planning around a hair transplant, typically seen in clinics where the doctor who's doing the surgery is not particularly qualified or doesn't have the right level of knowledge in terms of long-term planning options. That's why it's really important that you go to see a surgeon who knows what they're doing from a reputable clinic that can give you a long-term strategy, because a hair transplant should always be last resort consideration. Like I said, we talked about medical therapy as well alongside it, and that's really important to maintain the stability there. So that, it's quite clear to see that's what's happened here. He's lost a lot more hair behind the implants.
Right.
Going on to the next one, I mean, this is a very typical example of somebody who has a very large crown area, and the grafted area is quite visible with regression around it. The crown's actually increased in size, and so again, another example of poor planning, but also the density is very poor, and that suggests that whoever's carried out this transplant didn't use the right judgment here. I would have probably said to the patient that it's not going to be a suitable case for us to do because the donor was limited.
Right, so you just didn't have enough hair that you could transplant into the area, and you knew it was going to grow, he was going to continue to lose a lot of hair very quickly, right? So he's just kind of...
Yeah, I mean, what you have to bear in mind is there's a supply and demand issue here, right? So if you've got enough donor hair and it's viable to do the transplant, you might need more than one session, and that's okay. But with this gentleman, clearly, the area is really large and the donor is very limited. So if you take a lot of time and it's done in a very skilled way, you can just about get a decent result in these situations. But unfortunately, with this gentleman, the stability hasn't been maintained. So he's lost a lot more hair around the crown that's been transplanted, and then that's left him in a really difficult situation that's going to be difficult to correct.
And the final one?
Yeah, so I mean, this is a very typical example of over-harvesting. So we talked earlier about what we tend to see coming from clinics abroad versus what we see local clinics. I mean, a lot of local clinics are particularly low-cost clinics because they're working on volumes rather than quality. In my opinion, tend to produce results that are over-harvested. And the important consideration here is that the doctor isn't always doing the procedure in these clinics, and that's why they can offer it relatively much cheaper. You'll have usually technicians that are harvesting that are untrained, and not paying due care to the harvesting process. And that can lead to over-harvesting like this, which is irreversible and very difficult to fix in any case.
All right, so another good reason to pick an ethical hair transplant surgeon who's not going to overpromise, I guess. It seems like a lot of these issues around overpromising results, and then it just doesn't work out, or they don't ensure that they're using proper follow-up care, by the sounds of it.
Yeah, absolutely. And then finally, we've got an example of somebody who's got had a really low density result, and this is something probably this is the most common repair type of procedure that I would be doing. Patients come in after having had surgery, and then a lot of the time they're just never quite happy with the results, and they don't say anything perhaps for a few years, and then with time it tends to worsen, and it gets to a point where they have to seek help. So often, I'll see these patients. The good news is a lot of times we're able to do a really good correction for these patients, so we can improve the result.
So in these patients, they just haven't had enough done initially?
It can be multifactorial. A lot of times what will happen is they've actually had the grafts placed, but they don't take for whatever reason. Now, in my experience, from what I've seen, a lot of patients have shown me their immediate post-op pictures. So it's one of two things. Either they've had the volume of grafts that we'd expect, and then the growth has been really poor, and that could be down to poor technique. It can be down to poor handling of grafts and several other factors there. Or they've been told they've had 3,000 grafts and it looks like they've had 1,000 grafts, right? So there's a huge disparity between what they've been told and what's actually happened. And unfortunately, that happens a lot in the UK.
Really?
Again, at the lower cost level, you tend to see those problems. So, I've had patients who've been through that process and then, looked at it and thought, well, I paid a very low cost for a transplant, but now I'd pay anything to fix it. And so it's always better to have that consideration when you're first looking at transplant. Make sure you choose a clinic that and the doctor that know what they're doing.
Buy nice or buy twice.
Absolutely. Applies to hair transplant more than anything else, I think.
Thank you, Dr. Raja. That's been really interesting so far, learning a bit more about hair loss, but also, what to expect pre-hair transplant, who's a good candidate, that kind of thing. What would be really great to finish off the episode, we're going to do 3 myths around hair loss or hair transplants. I'm going to start off with the first one, which I think is probably the biggest myth, I think, around hair loss, essentially. And that is, and I've heard this lots, if your mum's dad is bald, then you're much more likely to go bald yourself.
Yeah, I've heard that one myself many times. So that is a very common misconception. I think it's important to note the role of genetics with hair loss. It's massive, but we don't know specifically where you're going to pick up those genes from. There's a tendency for people to think it's more maternal, and there could be some element of truth to that, but you find that there's a possibility you can pick it up from either side of the family. So there is variance there. We tend to find, oftentimes you'll see a family of, let's say, 4 brothers, 3 of them will be completely bald and 1 will have a full head of hair. And, the father will be bald as well. So you think, which side did he pick it up from and where did the other brothers get it from, right?
Both of my parents' dads are bald, so I think
You'll be coming to see me soon.
Yeah, well, probably will be. The next big myth is wearing a cap, I don't know, baseball cap or whatever, is going to make you more likely to go bald.
Again, a very common one. Now, it's not true. However, the important thing to remember here is there is, like I mentioned earlier, there is something called traction loss. So traction over long periods of time can put a pull on the hairs and they can thin and fall out because of that. It's unlikely, that's never really going to happen from a baseball cap, but if you're wearing like a helmet every day or something that's quite tight fit, there's a possibility you might have some element of that. And typically seen in females who pull their hair back tight and wear a ponytail, you tend to find that, the forefront of the hairline, the hairs tend to weaken and fall out.
Right, okay. So it's not something you see in helmets or caps very obviously, but it sounds like you see it quite a lot in women, essentially.
Yeah, my one of the most common presentations in women that come to see me for hair loss would be traction alopecia. A lot of the time that could be from tying the hair up in braids from an early age, or pulling their hair back really tight if it's part of their job, for example. They have to pin their hair up. They tend to find the hairs at the front tend to weaken and fall out. So yeah, it is very common, but like I said, that's more if you're putting pull or traction on the hair. It's unlikely that's going to happen from wearing a cap. So I would debunk that one.
Okay, good to know. And then the final one is that hair transplants hurt a lot, so don't get it done.
Well, it depends where you go and who's doing it as well, right? So, you will feel the pinch of the anesthetic injections. There's no way of avoiding it. There's all these things out there, needleless injections and it's part of the procedure, but the focus is always on making the rest of the procedure pain-free. So my patients, 2 rounds of anesthetic. We'll start with the donor area. That takes about, I'd say, 30 seconds to a minute to administer each round. So you have 2 rounds of anesthetic in the donor. Within a couple of minutes, it's all starting to go nice and numb. Before we actually start harvesting, you shouldn't really feel anything sharp. And that should be the case for the duration of that procedure. We top you up as we go along. So the best thing I can describe it to you as is when you go to the dentist and you have the same type of injection and the dentist keeps you topped up as they're taking the tooth out or doing any dental work. We do it in a similar way. And then when we come to doing, let's say, the hairline, you'd have 1 more round of anesthetic. It takes about 20 to 30 seconds to administer that. And when they've kicked in, you shouldn't really feel anything. Patients will often be watching TV as part of this process and they're comfortable, relaxed when it's happening. So if you're feeling pain throughout the procedure, and I've had a lot of patients that have come to me after having a procedure done abroad and they said it was horrendously painful or they were really swollen, and a lot of the time, it's just not necessary for anybody to be in that level of pain. So if the anesthetic is done well, you shouldn't really feel anything throughout the procedure in the way of pain.
So thank you very much, Dr. Raja. I mean, I've learned a lot from that, and hopefully everyone watching has as well. I'll be booking my hair transplant soon, I'm sure. If you liked the video, then please click the like button and subscribe for more content like this. And you can find out more if you're interested in either hair loss treatments or hair transplant surgeries at manual.co. Thank you very much and see you next time.